our content is always going to perform worse than someone who's doing like booty shaking.
Yeah, you won't find me doing that.
Me neither. I don't know how. Welcome back to another episode of the Tooth or Dirt podcast, an impromptu part 2 with Dr. Charlie Cage. If you didn't listen to part 1 last week, we talked about her journey in dentistry, how she became a dentist, how she's a dentist in the Navy, how she went to high school in a very formal way that I didn't even know that existed, and how she struggled with burnout and what she kind of did to overcome it and manage the very, very obvious symptoms that we all have with burnout in dentistry. And I guess I struggle with that too, and trying to find a balance is really important. We shifted gears for part 2, and we're going to be mostly talking about social media and social content and how we create content that inspires us and that we focus on that versus the vanity metrics that we all like to see but aren't really that important. So stay tuned for this part 2, and I'll see you later. Bye. A little bit about your content, because my biggest thing that I love to do is I love seeing people's history on their pages, and I scroll from the beginning, and I feel like I do that with mine too. And there's certain things that are on my page that I don't want to delete, even though they're not the vibe anymore. Yeah. So whenever I get to meet someone new or start to follow someone new, I scroll all the way to the bottom, and I'm like, take it to the bottom. I want to go from
what did you see?
The 2015 posts that were oversaturated and very high contrast. And then I want to see the part where you try and be like everyone else. I want to see that part where we're all making the same videos with the pointing and the doing and the things. And then I want to see the messy part in the middle where you try and figure out what it is. And then where are you now? And I feel like every creator has that. Mm-hmm. Some of them don't because they stopped at the trying to be somebody else phase. Gotcha. And never figured out who they actually are. So that's my biggest thing. I love doing that. I love over analyzing where people are in their creativity, not as that it's bad in any way, not judging in any way, but I find it really fascinating to see how people develop in their creativity, especially in dentistry, because yes, it's a hands-on creative field, but to be digitally creative, thoughtfully and intentionally takes a lot of work. Yeah. So tell me about your evolution of...
I don't even know what's on there anymore.
You don't?
But I started my Instagram when I was in residency.
Okay.
As a way for me to easily communicate to dental students on how to do certain procedures.
Was that the goal from the beginning? The goal was
that was the goal. Yes. Okay. Because I feel like there's a lot of information that you need to learn in dental school. And sometimes it's an important point and it's only mentioned once, but it's a foundational piece of dentistry that you need to practice. And sometimes it's just boring lectures, you just kind of over it. So I thought that if I made some engaging videos, that it would be a resource that's free, so that people can learn from. So that's when I first started it. But then I realized it wasn't just sharing dentistry that made me happy. It was the video creation. Mm-hmm. I'm an introvert, and even putting myself out there, I felt very uncomfortable. And I felt like I was hiding behind my dentistry. And so once I really started to be more comfortable with online criticism, because, you can get it all the time once you start to post. Once I started to get over that, I felt more confident in myself. I started to show more of my own personality. And I wanted to basically stand on top of a hill and yell to other dentists to take care of yourself.
Yeah.
Take care of yourself. And it's more so for female dentists, because I feel like as a female, the way that we're raised is to just show a lot of empathy to care for our patients. And I see these female dentists or female dental students that will go all day running around clinic and will not take a break to drink some water, to use the restroom, or to eat. And unfortunately, that continues after dental school.
Yeah.
And ADA, they had an article released that talked about anxiety and depression in dentists. Why is this a problem? Why are we experiencing burnout? Why is it that so many dentists, after practicing for 4 years, they just want to say goodbye, close the door, we're done? When it was something that we felt so passionate about and spent so many years to become a dentist. Why are we willing to give up on it? And it's not because of the career itself, it's just how we approached it, how we gave everything up for the career. And now that we have it, we realize that we lost ourselves in the process. So I'm an advocate to yell at other female dentists to say, make sure you care for yourself. And if you're in survival mode, don't worry, we can get you out.
Yeah.
And know that this whole self-care, it's a journey. And sometimes you go forward, sometimes you go back, sometimes you go sideways. But it's all about long term, what progress that you're making. And so when was it? 2016, no, 2014, I started to have a lot of just debilitating pain. And it took about a year and a half for me to finally get diagnosed with fibromyalgia.
No way.
Yes. And it's all from chronic stress.
Really?
Yeah.
How?
So,
Where did pain start? How did you start to feel? Like what did it feel like? And then how
yeah,
did
it
that all
felt like,
unfold?
yeah, like deep aching pain in my bones.
Hmm.
Just the
Everywhere.
most painful thing. And I would have random swelling on my body. I would be sick all the time. I felt like I was 80 years old in a 20-year-old body. Like it
Wow.
made no sense. I was tired, foggy, depressed. It just made no sense because I was at a point in my life where I was a dentist, I was young, should be, at the happiest point of my life. But here
Yeah.
I am just laying in bed in pain. And so once I got the diagnosis and luckily had a provider who was very knowledgeable with it and how I can overcome that pain with my mindset, with my
Hmm.
self-care, um, it was life changing at that point. And I think that's the last thing I would want for anyone is to experience the amount of pain that I've had to. I think it's definitely avoidable, but we have to create awareness.
So just by shifting your mindset, no other therapies, nothing else that you had to do.
Oh no, I used everything. The amount of pain it was, I was like, no, we're gonna go full
We need
force.
drugs. I need drugs for
No,
this.
well, yeah. So I did medication for about 6 months. I despise taking medication. So I did it for 6 months just to get me to the point where life was bearable. But
Yeah.
therapy, working out, high protein diet,
Hmm.
and just starting to take care of yourself. And it definitely wasn't a flip of the switch. It took a lot of time, a lot of work, a lot of falling down, getting back up. Um, but like I said, looking back, I see the progress, and
Yeah.
that's pretty much what I can be grateful for, you know, and then to
Yeah.
help other people so that they will not experience the same pain that I had to.
And since then, any signs or symptoms of it still lingering or returning? What's the
Oh
like what
yes,
is what does your day-to-day life look like now?
yeah, it's definitely lingers, but it's more so like, oh, there's like It hurts a little bit, but definitely tolerable. It's not to the point where it's just like I'm laying in bed all day just crying. It's definitely not to that point anymore. And it will act up more when I'm stressed, which with my job, it's kind of
Right.
it's difficult to avoid.
Yeah.
Um, but I look forward to retirement. So I retire in 4 years.
No way. 4
Yeah,
years?
yeah, yeah.
Congrats.
Thank you. I'm
You look way
excited.
too young to be thinking about retirement, but I think that that's
Well,
like a really rude thing for me to say because like what does retirement age? I would
well,
love to
yeah,
retire
but
now
yeah, yeah. Retire from the Navy.
from the Navy. Yeah.
From the
And
Navy.
that's after how many years? 25
20.
years? 20. Right. Okay.
Yeah. And
That's
so
cool.
I'll retire and then see what life brings me from there. But
Will
we'll
you
definitely
still
not be
continue
working
to
full time.
practice dentistry or what do you think?
I think so.
Yeah.
I really love my job. I just think I'm tired of doing it full time.
Yeah. So are you currently working 5 days a week?
Yes,
Yeah. Long hours.
at
So
least.
what does this health clinic look like?
So it's a dental clinic. So we have a dental portion, and then there's a medical clinic. It includes like dive medicine, occupational health, pain management, physical therapy. Yeah, those are the different departments, but
All in one. And are you the only
all in
dentist
all.
or are there multiple dentists or more
There are
dentists
multiple dentists and medical providers too,
and
so
hygienists as well?
hygienists too.
And where are
Mhm.
you now?
I'm in San Diego.
Oh, you're in San Diego. Okay.
Yeah,
Oh, that's interesting. So
yeah,
um I love how much of your personal I mean and I know that yes, you're posting lifestyle content, but it's never all of the life. I mean, we let people see how much we want them to see and it's
yeah,
curated
yes,
and
100%.
but I love that you're sharing some of your personal life. I think that that's always something that's really helpful.
Yeah.
Um and that is on brand for you. Do you ever find that people engage more with dental stuff or lifestyle stuff? Or is it, what's your distribution? Because for me, I struggle with the lifestyle stuff. Like
Yeah.
everyone wants the cases, they want the dental. And then it's like, well, no, she can't be a real human being and have a life. Like we don't want to know what the behind the scenes is. Uh, nah, her
Yeah.
shampoo, no.
Right.
She
If
uses face masks.
you have
God
skin.
forbid she drinks coffee. Yeah.
Yeah. No, if I post dental related stuff, the dentists engage.
Yeah.
And if I post lifestyle stuff, my followers who are not dentists engage. And then if I post coffee stuff, my coffee lovers engage. Is and then I just have like my close friends who will just like whatever I post.
Yeah. The
But
fans.
yeah,
The
I
ones in the
definitely see
back
the
with the little sign. Yeah. You
yeah.
go, girl. Mhm.
Yes. Yeah, it really depends. Because sometimes I'll post similar videos at different times, and one will take off, and the other one will just completely flop.
Yeah.
But luckily, it's just I just have a lot of fun doing it.
Yeah.
Because otherwise, I don't think I would keep doing it. Because
Yeah.
Instagram is just hit or
It's
miss.
exhausting.
It can be definitely,
Exhausting.
but
I'm at the point now where I just don't care anymore. Not that I don't care. I care.
no,
I
I get it.
care. It's planned, but I don't care what people think anymore.
Yes. Yeah.
And I don't care. Like I have so many filtered words on my comments that like I won't even see a comment. If someone
Ah,
uses a specific word that I know for me is going to trigger something in my
uh,
brain,
yeah.
it won't even make it to the post.
Yeah, that makes sense.
And it's just like, I don't, social media is supposed to be for you. Like it's
Hmm.
supposed to be an outlet for your creativity. It's
Yeah.
supposed to be a place where you put your thoughts, your passions, your likes, your
Hmm.
things, sure, your life, clinical
Yeah.
stuff. But when we start to hold back in order to do it just for the partnerships or the
Hmm.
thing that everyone is there for, you kind of lose yourself a little bit of it.
Yes.
So like
Absolutely.
when I look through your page, I see that same thing in your page that I see in mine. Like I have more lifestyle stuff now than I have ever had. And before I was trying to do the trending jokes and the videos and the memes, and I hated it. I was like, I don't want to be this person. I can't dance. I can never lip sync. Like, give me more than 3 sentences and like the timing doesn't work. It takes me 45 minutes to record one video pretending to be, I don't know, Shania Twain. And and I could spend 45 minutes creating something else that I really like.
Yeah, definitely.
So
I would definitely agree with you. Like I tried the whole like pointing thing and I'm like, oh no, can't do it.
5 things everyone needs to know about. I did that too. Moved on.
Just over it. No.
I would much rather spend more time now, like with good content. So I love your filming. I love your
thank you.
You're like I followed your little equipment filming gear highlight because I'm like I love to know what people's camera setups are and what they're using. So I'll share your profile in the description below and encourage everyone to take a look. I think it's too easy to put a camera on a tripod and push record. It takes so much more time to think about close angle. What's my aperture? What lighting source do I need? Like a still
on the topic of the whole like Instagram and the engagement and depending on what is it that you post. I remember there was one video that barely had any views to it. And a couple of days later, I think I was walking around work and somebody who follows me was like, oh my gosh, like, I really like that video that you posted. It really spoke to me. And they were like, thank you for posting that. And I was like, you're welcome. And I was like, but why didn't you say anything?
Why didn't you say it live out loud?
Like, you literally did not engage. You didn't like, you didn't comment, nothing. But it just helped me to see the perspective of maybe a normal viewer who's like, oh yeah, that was really good. And then they just like absorbed it and that was it. Understanding the concept that as creators, we need them to like hit a like or like comment kind of goes over their heads. And I was like, oh, okay. So I really should not base the value of my posts on views or likes. That I felt like that was a really good reminder.
Yeah, it's true. And I think we're guilty of it because we just want to know, like, was this even worth the time? Like, was it even worth the hours of planning and the saved posts and the scripting and then this and then that? And we just really want to know, like, is it even worth it or not? And that's how we met. Like, those are the metrics that we follow. I've been giving people free downloads now. Like now I don't even care with the views or the likes anymore. I just want to know that's if people are downloading a resource that I made or that I put together, then I know that it's something valuable. Because a post is going to disappear. I mean, even if it lives in perpetuity in your feed, like it's going to get filtered and pushed down, but something tangible that someone might use to treat another human being differently, I think that is going to hold value.
Yeah.
And there was someone that downloaded one of my resources from last year and I like got to meet her at a conference in real life. And she said to me that she does her new patient exams differently now. And now every person has an extraoral and intraoral exam. And I don't know if she's like noticed anything suspicious, but just to think that at some point, something that I did may have saved another human's life, you know?
I know.
I think that's valuable.
Yes. Oh my gosh. Yeah. That all matters, you know?
Yeah.
I think it just circles back to like when I started my whole self-care journey, I used to listen to a lot of Wayne Dyer like podcasts and whatnot. And he talked a lot about killing the ego. And I think that's what most of it revolves around is that when we post content, our ego says this should be liked because I think it's great content. And so it's that shift that says I posted it because I liked it. And if other people like it too, then that's great. And if not, it was for me anyways.
Yeah.
No.
That's great.
That's constant reminders because I forget very
good reminder.
frequently.
Yeah, for sure. And it's discouraging when I mean for me, I think it's discouraging when I know other creators that post stuff for the likes or the views and then buy followers and buy comments and buy
Yeah.
boosting.
Mhm.
Um, like that really, I don't know if it's just like maybe I wouldn't have cared 5 years ago, but I care now because I care about that person. Like
Mm.
they don't realize what that will do for to them in 5 years from now.
Yeah.
And like relatively young creators, relatively new creators early in their careers that are just so hyper focused on those numbers.
Mhm.
And who knows, maybe they'll be successful and maybe money is the bottom line. But like
Yeah.
mental health wise,
Yes.
for me, I've gone through such a struggle in the last few years because I don't want to do those things, but
Mhm.
I feel like I should be because people are saying, well, you're not growing fast enough or you're not getting X amount of views. And I'm like, yeah,
Right.
but I don't want to have to deal with the ramifications of what that might look like
Yeah.
later mentally.
Yeah. It's so funny because I have a lot of people who will ask me what what gear did you use, or the quality of your video is really good. And I'm just like, but yeah, but I have like this many followers. Like it's not a lot. I'm not
You
really
totally,
growing.
I'm honestly like, when I look at your page, I'm shocked. Like, I'm shocked. But that's because people use social media for two reasons. The ones that really want to learn stuff,
Mhm.
and then the ones that are just looking for a break in the day and they're doom
Yeah.
scrolling for
Yeah.
laughter.
Right.
They're not going to find laughter on my page. So like maybe some of my dry jokes, but like really I'm not doing any of the memes and things.
Yeah.
So we're our content is always going to perform worse
Yeah.
than someone who's doing like booty shaking.
Yeah. You won't find me doing
Me
that.
neither. I don't know
Yeah.
how.
I'm
I'm,
like,
I'm like,
it's just
maybe
not
I'll
worth it.
try.
Yeah.
No,
It's not
no,
worth it. And
no.
that's one of the things too is as
Could you
I
imagine? Could you imagine like we try and do a sponsored post and we like pitch to Phillips? We're like, so get this, we're going to do a twerking video and we're going to try and twerk as fast as a Sonicare toothbrush. They'd be like, so your
I
contract
don't
is
know.
now, yeah, no, thank you.
But
Maybe
I had
later.
to have that balance because as a content creator, I do want to see that growth.
Sure.
I think that's just natural. Because if you're like, if you want to voice, your message, having a bigger audience is always the goal. And they always post, oh, you want to go on Instagram, you have to post every day and you have to engage for like 20 hours.
Right.
And I'm just like, yeah, that's also not healthy.
Could
So
you
how
imagine
can
being on there
I,
for that long?
sorry?
Could you imagine being on your phone for that long?
Oh gosh,
It's
no.
exhausting.
Gosh, no. So it's just like I had to have that balance. Okay, well, I'm not going to grow, but I'm only going to engage for like maybe 15 minutes and that's
Yeah.
it. So even with Instagram in itself, I had to maintain my boundaries. And luckily with the iPhone, it tells you how much time you spend on the
Hmm.
app. And so that's my little, keeps me in check to make sure
Yeah.
that I'm not constantly on my phone, especially in front of my kids. I want to be a good example for them. And so instead of having my phone up all the time, I want a book instead.
Yeah.
And so then they're more likely to say, well, mom, dad has a book. Let me get a book. But if I have the
Yeah.
phone all the time, one,
They
I
want to
miss a
watch
lot of
something.
things. I miss a
Yeah.
lot of things that they do. But then they're like, well, can I see what's on your phone? Or can I get an iPad or something? But I'm giving the example of this is what adults do. And it
Yeah.
shouldn't be I'm on my phone all the time.
Yeah.
So it's
I love
hard
that. Well,
when it's
everyone
your
needs
kind of
to
your
follow
side
you.
job.
I'm saying
Yeah.
this out loud. I'm going to post it on my Instagram that everyone needs to follow you, especially people that like clean content,
Oh,
like
well, thank you.
clean videos, thoughtful footage, high quality videos, high quality content. Like
it's so rare in our dental industry. And you'll have a video that will blow up and your follower count will just like 10 times X. And we'll have this conversation in a year from now, and your 2,500 followers is going to be at 25,000 followers. And you'll be like, oh, remember that time I said my stuff wasn't growing because I'm spending too much time making good videos? Well, that'll change.
I'm going to be like, no, I don't remember.
Yeah, that'll change.
Yeah.
That'll change. Well, thank you so much for sharing your story and your journey. It means a lot that you're, putting yourself out there and being vulnerable to share how difficult things have been for you. I admire you very much. And I hope I get to meet you in real life. Will you be at CDA in Anaheim? No, it's like a conference. No, you don't go to the conferences.
It's hard. it's
with the
difficult.
Family and the kids and the life and I get it. Well,
so
maybe one day.
I usually go to the ones that are local. It's a little bit easier, but
Well, maybe one day our paths will cross.
I hope so.
Yeah,
I hope
it was nice to meet you. Thanks so much.
Thank you for having me.
All right, everyone. Until next time. Peace out, peeps.